You shouldn't smoke cigarettes or vape, and here are a couple of reasons why. According to the CDC, in 2018, nearly 14 of every 100 US adults aged 18 years or older currently smoke cigarettes. This means an estimated 34.2 million adults in the United States currently smoke cigarettes. More than 16 million Americans live with a smoking related disease. Cigarette smoking remains high among certain groups. Some of these groups are men, adults 25 to 64 years old, those with a lower education, those below the poverty level, and those in the Midwest and the South. Tobacco smoke contains chemicals that are harmful to both the smoker and those around the smoker. According to the National Cancer Institute, there are more than 7,000 chemicals in tobacco smoke, and at least 250 are known to be harmful. Among the 250 known harmful chemicals in tobacco smoke, about 70 can cause cancer. The National Cancer Institute also found that smoking is the leading cause of premature and preventable deaths in the United States. Cigarette smoking and exposure to tobacco smoke causes about 480,000 premature deaths each year in the United States. Of those premature deaths, about 36% are from cancer, 39% are from heart disease and stroke, and 24% are from lung disease. Mortality rates among smokers are about 3 times higher than among people who have never smoked before. Cigarettes are also pretty expensive. The price varies by state. Here we have a breakdown of the average retail price per pack, the price of different taxes, and the total price of a pack of cigarettes in each state. As you can see, the cheapest states to buy cigarettes in are Missouri for a price of $5.29, Georgia for a price of $5.90, and North Carolina for a price of $6.11. The 3 most expensive states to buy cigarettes in are Massachusetts at $14.08, Connecticut at $14.95, and New York at $15.22. Many people turn to e-cigarettes, also known as vaping, to help ease them off of cigarettes and eventually help them quit smoking as a whole. Vaping is less harmful than smoking, but it still isn't safe. When talking about vaping, Michael Blaha, the director of clinical research at the Johns Hopkins Center for the Prevention of Heart Disease, says, "There's almost no doubt that they expose you to fewer toxic chemicals than traditional cigarettes. However, there has been an outbreak of lung injuries and deaths associated with vaping." Research also suggests that vaping is bad for your heart and lungs. Electronic cigarettes are just as addictive as traditional ones. Nicotine is the primary agent in both regular cigarettes and e-cigarettes, and it is highly addictive. A new younger generation is also getting hooked on nicotine because of vaping. In 2015, the U.S. Surgeon General reported that e-cigarette use among high school students had increased by 900%, and 40% of young e-cigarette users had never smoked regular tobacco. Vape cartridges are often formulated with flavorings that appeal to these younger users. So the best thing you can do for your health is to stay away from cigarettes and e-cigarettes.